The federal government and SightSavers Nigeria, an international non-governmental organization, have collaborated to conduct free eye screening and treatment for 400 staff of the National Bureau of Statistics (NBS). Mr. Adeyemi Adeniro, the Statistician General and Chief Executive Officer (NBS), said the initiative would help to detect vision problems affecting staff performance.
When we started this discussion, it was like we were just joking about it. They came for another event, the inclusive data charter that we want to launch. We were discussing that program, and then the issue of testing, the eye test for staff came up. And we just said, okay, this is in line with our resolve to give to our staff good health, good welfare, because we don't consider just promotion or giving money as welfare. There are a lot of things that can be done to staff that also serve as welfare to them. So giving them support in terms of health care delivery is also a kind of welfare for us. And when SightSavers said they can offer that service to our staff, we quickly jump at it. Since then, we have been meeting to see that this come to reality. So when they came last week to start the test and started issuing eyeglasses to staff, I've been receiving so many commendations from staff. Even those that are using glasses before, they said the one that is given to them now serves better than one they used to have, even the one they are paying for, that this is better than the service they have been receiving from their various hospitals or clinics before. It's a way of improving and boosting our productivity, because when you give assignment to people and they are having problem with their sight, either to use the computer or to even read some tests, some books to get what they want to do. So if they don't have good eyesight, it will be a challenge to deliver that assignment. But with this, we know that having 300 people that have improved sight is a lot to boost our productivity. Some of them will do more than what they are doing before. Some that have not been up to expectation will be able to perform up to what is expected of them. So I expect that we are going to see a lot of improvement, a lot of value added from this staff that have gotten this treatment going forward.
Dr. Shu'aibu, SightSavers Country Director, said the organization was proud to collaborate with the NBS on this initiative by providing free eye screening and spectacles to its staff. Dr. Tochukwu Jamike, an optometrist with SightSavers, stressed the need for regular eye check to avoid blindness or eye health problems that might affect vision.
There are some causes of avoidable blindness, something like cataract, glaucoma, refractive errors, and the rest of them. Most people have these problems, but they don't even know they have them. So SightSavers felt it's important to go into places like this, like National Bureau of Statistics, because they play a lot of with numbers and they use systems a lot. So most of these people, most of the staff of this place have these problems without really knowing they have the problem. So SightSavers felt it was necessary, or it's necessary to examine them and assist them in the little way they can by providing reading glasses and some drugs for people with symptoms of dryness as a result of too much prolonged use of electronic devices. Yeah. Eye is one of the most vital organs for sight. So my advice is do not neglect it. It's very small, yes, but if I believe if you ask people without vision what or how it is, it's not an easy one for them, because once someone is blind, you are inconveniencing the next person beside you.
Mr. Sunday Ichedi, a beneficiary and Director of Statistics, International Statistical Development Department, NBS, highlighted the critical role that good vision plays in handling data accurately.
Sight is very, very important. Without sight, there is nothing you can do. we deal with data, and if you don't have a good sight, you may end up in giving or producing bad data, which will affect the economy and overall development of the country. So we requested that SightSavers should come and look into our site challenges in the office, and here are they. Personally, I benefited from them because my site has not been good. I joined this service long time ago, and my job was to give data. So I'm always playing with data, and that affected my eyes. I couldn't see very well. I've been to several eye clinics, but the problem was not solved until SightSavers came, and thank God they gave me an eyeglass which is helping me now to see clearly.